Welcome to Morgan Hill Health. My name is Bernie Mulligan, your host. Morgan Hill Health is sponsored by the Morgan Hill Community Health Foundation. The goal of this TV show is to provide general health-related information to the residents of Morgan Hill. Our guests today are from Kaiser Permanente: Chuck Cook, South Bay Senior Vice President and Service Area Manager, and Diane Ochoa, Medical Group Administrator from the Santa Teresa Medical Group. I prepared some questions for you folks today, and I hope you can give us some answers. Our first question is, I understand that Kaiser Permanente is the largest HMO in the country. Can you tell me briefly how your company is organized?
First of all, Bernie, thank you for inviting us here today.
You're welcome.
Kaiser Permanente is it's a national organization in 9 states and the District of Columbia. However, its history began here in California. In fact, over 6 million of its 8.5 million covered lives or members are here in California. Now, we're structured, first of all, in California we have 2 general regions, in the north and in the south. And in the northern region, that's where we're located right now, we have service areas. You mentioned in the introduction here service from the South Bay service area. The South Bay service area really includes southern San Mateo County and all of Santa Clara County, and 3 hospital facilities, including Santa Teresa, which is in San Jose. Now, within the South Bay, there's 600,000 members, and of course the Kaiser facilities, the clinics, the hospitals, and the Permanente Medical Group. And I think the more important thing about our structure and how we're structured is the fact that we are an integrated delivery system, which means that the physician organization, the Permanente Medical Group that is, the hospitals and clinics, and the health plan, which we know as a health maintenance organization, are all under one umbrella. And that is a very significant feature organizationally. And what that allows us to do is have those various components of the organization work more closely together.
I see. You just mentioned integrated care. Could you tell me how the integrated care is beneficial to the patients?
Absolutely. Well, first of all, I'll have Diane comment on the integrated care portion, but let's, as a context to the care, the integrated delivery system itself is really the context for where the care is delivered. Basically, by having the hospitals, clinics, and health plan together under one organization, it allows us to set up systems and communications between physicians, the hospitals, clinics, and the health plan that are very coordinated, that work together. We basically spend our energy and time and resources making services work better for the member. This is uniquely different from other types of organizations or the general way that healthcare is set up in this country, where hospitals negotiate with HMOs and other payers, and other payers negotiate with medical groups, and in some cases it's individual medical practices. And a lot of time and effort is spent, and in what we believe is wasted, on those types of negotiations and communications. By having us all under one organization, we can keep our focus on the member, and we don't have inter-company negotiations. We work together on that. Now, how that relates to care, I'll let Diane expand upon that.
I think the integrated system is probably the most unique thing that Kaiser Permanente has. And what that allows is for our physicians that are working for our members to be able to get information when they're in the hospital, when they're out in the ambulatory clinic, and all of that is available just under one roof. The other real distinction is that our physicians really are making the decisions on the care of our members. They don't have to ask to refer to a specialist. We're all under the same roof. They can refer a person on the same day down to a specialist if they feel it's needed. They don't have to call a health plan to ask them if it's okay. They can do what they feel is best for the member. And it's very rare to see people that have hospitals, ambulatory care, and a health plan that work together for the same purpose, and that's to take care of our members
I see.
in a high-quality way.
Excellent. Hi, folks, a question. Do you see HMOs, and specifically Kaiser Permanente, as having a permanent place in the healthcare in the United States?
Good question, Bernie. You know, I can't speak to a lot of the other HMOs. You know, it's a pretty rugged market out there these days, and we've seen cases where many have gone out of business. However, let me speak about Kaiser Permanente. As we've talked about just a minute ago, it's a bit of a unique health maintenance organization because it is also a delivery system. And because of that, and because of the fact that we are a national organization, we're nonprofit, and we're large, those factors, I believe, you know, really set the organization up to be permanent in the future. In fact, there's been many people that have suggested that this should really be a model for the future in healthcare because of all the aspects that affect quality and service, and certainly with the heritage of Kaiser being an affordable plan as well. So, Diane, I don't know if you can add to that.
No, I think that you've explained it very clearly.
Well, I've heard people talk about the labor management partnership at Kaiser Permanente. Could you explain a little bit about that, maybe?
Yeah, I think I can probably, since I've been actively involved in that for several years. In the late 80s, we were going through a lot of labor turmoil. We had had some very costly strikes that basically affected not only our members, but our staff, and was really unsuccessful for both of us. In the late 90s, AFL-CIO leadership approached Kaiser Permanente and working together in this chaotic healthcare environment to see if we could do better things for both their employees and our members. It's an unprecedented large labor management partnership. There's 25 unions across the United States that are involved in the partnership with Kaiser Permanente. And this is probably the largest healthcare union partnership that is around. There have been union partnerships that have been very successful in Saturn, in Harley-Davidson, and we really went and looked at them to see how they were successful. We really want to involve our staff, our labor partners, in how we do our business, how we make decisions on what we do, how we work together to make it a good place to work so they can grow their membership, we can grow our membership, we can be cost effective. So we actually involve our frontline staff in decisions of how we do our business. And we've spent a lot of time training them on what is healthcare business so they would understand and be able to participate with us.
Well, that brings up another question. How do large healthcare management organizations like yours measure the quality of healthcare to the patient?
Well, that is a huge area. Let me just go back to the issue of size. You know, one of the dilemmas in measuring quality, and this is an area where size is good. We may not intuitively think that going into a question like this, but one of the issues is having enough of a population to determine what is efficacious, what works best, and that takes a population base. Or if you're into statistics, many people are, some aren't, but you need a denominator sizable enough to have a legitimate conclusion to what really works and what doesn't. If you're a single office physician, you really can't get that on your own. You either have to be a part of something or it's just not there because you only see what you see. But if you have 8.5 million members, it is as a base of looking at what are the things that really do work, what are the things that don't, you can get to those answers much quicker. And we have an incredible amount of examples of where that's come to play. And just to mention one that is really quite unique to Kaiser, in Northern California, heart disease is not the #1 killer for Kaiser members. That is very unique because it is in the rest of the United States and the rest of California. And the reason for that is that the organization has the ability, and I'll go back to the integration again, to not only do surgery in a quality way if the patient needs surgery, but it has the ability to do the pre and post follow-up. And sometimes the follow-up is just as important when you look at lifestyle and longevity and mortality as the quality of the service being performed at the acute stage. And because of that, and because that is such a significant significant feature, it is no longer the number one cause of death for Kaiser members. That is an enormous departure from many other organizations. And Diane, I'm sure you have many other examples on the quality front.
I think that what we need to remember is that HMO is a health maintenance organization, and one of the goals of Kaiser Permanente has been prevention. There's a strong emphasis on preventing illness. But once you do have it, we have a huge program that's called chronic conditions management, that we actually have nurses and physicians managing people on a day-to-day basis to make sure that they can stay as healthy as they can. So the diabetic, the person with congestive heart failure, they're managed on a very aggressive basis to make sure that they can stay as healthy as they can. So on the prevention piece, we do a lot of health education classes, prevention. As far as how we measure quality, we basically measure ourselves against the same, what's called HEDIS scores, as every other health organization. So we look at mammography rates. We look at how well we're managing our diabetics, how well we're managing people with heart disease, how many people are getting childhood immunizations. All of those things, Kaiser across the whole program is a leader in those quality measures. We're truly outstanding at making sure that we take care of our people with disease or prevent that from happening.
That's great. I understand also that Kaiser Permanente is considering opening a facility in Morgan Hill. Do you have any details on that for us? Huh?
Bernie, I wish we had the details on it. That whole opportunity is really under the planning stages. In fact, we are considering not only a plan that involves our own build out or facility, but there may even be the possibility of a partnership. And in getting into those different options, of course, that takes a little time to be judicious about what we do. So we definitely want to do our homework. And as I mentioned earlier, these are days when you really have to have your diligence in what you do. So yeah, we have the plans. We are getting into those plans, and hopefully we'll get to a point where we have a timetable and a report that we can share.
Great. One of the things I've understood that the members can now book appointments and refill prescriptions on the internet. Maybe you can explain how that process works, and maybe you can talk about Kaiser Permanente's other digital capabilities you have.
Well, I think as we have an economy of people working more and being fairly time-starved, it takes time to come in and get your medications or book your appointments. And about 80% of the households have internet capability. So basically people are given a PIN number like you would use your ATM, and they go into our website and they link to our appointment system, and they're able to actually book appointments. They also can go in, and it's called e-refill, and they go in, they put in their special code, and they're able to order their drugs and pharmaceuticals over the internet, and they're mailed to their home. It prevents people from having to come in. They don't have to wait in any pharmacy. They don't even have to come into the facility. They can just do it from home. They can do it from work. We're trying to make it as convenient as we can for our members, that they can access health care, get health care information, pick a physician. We have a lot of capabilities on our website, and each of our physicians actually have a home page. So you go in, you can find the biography of your physician, you can get information related to your illnesses, his specialty, and you can do that all online.
That brings me to the next question. There's been a lot of talk about this automated medical record keeping that's been going on. How will that benefit patients, and where will that, when will it go live? Is it going to come, where are we going to see this in the near future?
Well, there's many parts to that project, Bernie. Of course, a lot of what we do today is already automated, but what we're looking at here is bringing a lot of the various parts together, even at a greater level than we've had now. Let me give you an example of that. Again, going back to the integrated model where we have clinics and hospitals and the whole health plan function. When it comes to clinical information, that is basically stored in a medical record. But in just thinking through all the locations, you can understand just the logistics of getting information in and out of various locations, and having it accessible to the caregivers in a way that if they're in, no matter where they were in Morgan Hill, up at Santa Teresa, that they can access that information real time in order to treat the patient. And this may sound pretty basic, but the healthcare industry in general has had some challenges in having those kinds of things automated to the extent that we want them automated. And particularly in an organization like Kaiser Permanente, where we have so many locations in our organization and are large, it's a real challenge to bring those all together. So for us, this is a major project. It directly supports the information that it takes to manage patients in any location in a high-quality way, and it also supports very fast access to care when that's needed as well. And Diane, you may want to add to that as well.
Yeah, I think that right now Kaiser Permanente has a fairly robust bus system, but the new medical record is even going to be greater. Right now, if you went up to Walnut Creek and you gave them your medical record number, they could look up to find out what medications you were on, what radiology imaging tests you've had, what allergy, what your last visit showed. They can do that all over Northern California. So that allows you to be a little bit mobile, but still know that we know about your health. The AMR record is going to be even better than that. It's going to have a big depth of information in it that we didn't even believe it was possible. So we're really looking forward to it. I think we're hoping in a couple years we'll see some of this actually in place.
Is there any area that you folks would like to expand on?
Well, thanks, Bernie. But one thing that comes to mind for me is just how this integrated model and our discussion about quality would impact Morgan Hill specifically. Now, the population here already, Kaiser Permanente represents about a third of this population. And yet we know in areas like this that there are limits to the kinds of technology and services that can be provided just based on the size of the population. By being a part of a system, we can make sure that what we create here, the kinds of services we provide here, really meets the needs of Morgan Hill and the surrounding areas. But by being an integrated model, that it allows us to have people access other types of services, what we call tertiary or quaternary services. These are services that are more complex at a higher level, that we require a larger population base to justify. But by living here, you can still have access to that. You may have to travel to Santa Teresa, or in some cases another location of Kaiser for something that is, we would call super specialized. But by being a part of the organization, we'd still have access to that. And that is a tremendous piece of it. And maybe Diane can expand on maybe some of the components that we've been thinking about. But before she does that, the other piece that I'd like to expand upon that relates to this is the orientation to prevention. That is a very key area that does affect the population here. Let me give you one example. Screening for diseases is a part of prevention and a part of what we do, without any barriers to access to do that. One area that has been significant for us is in the area of colorectal cancer. Within Kaiser Permanente, we found that our screening rates are more than double what they are in the general population and with other health maintenance organizations. And because of that, it allows us to detect cancer at an earlier stage. And if you detect it at an earlier stage, you're less likely to have that as a very severe acute case which would lead to death. That is a very significant finding. And because of the screening that is done and testing, and much of that is done locally as well, that is provided as a part of the plan. Now, in the difficult event, or the unfortunate event, if something is found, a cancer or whatever, then again, you're part of a delivery system that is integrated, and you would go to the best location to get that complex care. So even the prevention component and the screening has a significant impact on the population. And maybe, Diane, you can talk about at least some of the preliminary service components that have been discussed.
Yeah, I think that Kaiser Permanente is very aware of the dilemma that Morgan Hill is facing related to health care in your community. And because of that, we looked at an option of expanding our Gilroy medical satellite offices now that provides family practice and ambulatory care, or looking at possibly expanding here to Morgan Hill with another site similar to Gilroy. That is what we're really doing our due diligence right now, trying to figure out whether that's what option is best, but we have acknowledged that you don't have probably the family practice providers here in your community that you would like to have. What we are thinking and pursuing and investigating is a similar model as our Gilroy medical offices. Currently in Gilroy, we have family practitioners. It's a family practice model. So we have medicine, pediatrics, OBGYN, some dermatology, some podiatry. We have some allergy down there that probably is not suitable for up here because you try to keep those centralized and specialized. We would be looking at having a pharmacy on site, laboratory capabilities as far as drawing blood, being able to do general x-rays and mammography on site. So you would actually be able to do a majority of your health care, your primary health care at that one site. If you needed specialists, you could either go up to Santa Teresa, or we were thinking about seeing if it was worth it to have a specialist come down to our satellite maybe one morning a week, something like that. So all of these things are being kind of examined at this point. But as far as hospitalizations, I think that we really feel that people are spending much more time in an ambulatory setting than an inpatient setting. And if you did need hospitalization, as Chuck said, we have not only Santa Teresa, but every specialty that you could need within our system available to people for hospitalization, for surgery for hearts, neurosurgery for your head. Anything that we needed to have done, we have the capabilities of doing within our system. So that's really our preliminary look. We have toured the community to figure out if there is space available, if we had to build. And as Chuck said, looking at partnership with somebody, which does take a little bit more time. But we're very interested in participating as a community member also, and not only take care of our 1/3 of your population, but others that would like to join Kaiser. I would like to say that Kaiser Permanente has a really strong community health benefit. We do offer grants for youth, for seniors, and we frequently are giving out money with innovation grants or grants for communities as part of our community health benefit.
Diane, maybe you could tell us a little bit of about what you're doing as far as, say, extended hours in other localities in the area here.
Okay. At our Gilroy medical offices, for our members, we have an evening clinic that runs until about 7:30 at night, and that's Monday through Thursday. They do close on Friday and on the weekends. During that time, we also have our emergency room. We are a community hospital at Santa Teresa, in addition to being a Kaiser Permanente facility. We have an urgent care clinic there that is open 7 days a week until 2 a.m. in the morning. And then after 2 a.m., patients will go to our emergency room. So that is open also to non-members because of our community status as a facility and a hospital. Routinely, we don't run extended hours down in Gilroy past 7:30, but that has seemed to have met our patients' needs, and a lot of times you see people not coming to appointments if they have appointments at 9 or 10 o'clock. So it really has worked well to close around 7:30 down in that location, knowing that we have good services for them up at Santa Teresa.
Well, this has been a great interview.
Great.
Thank you, Chuck and Dan.
Thank you for having us.
For those who'd like to contact the foundation, you can contact us at the Morgan Hill Community Health Foundation, 275 Tennant Avenue, Suite 201, here in Morgan Hill, 95037. Our email address is healthtv@morganhillhealth.org. Thank you very much.